Updated daily med routine post-surgery.
Today is October the 29th. We're 2 days away from Halloween. What are you going to be for Halloween? I'm actually not going to be anything this year for Halloween. I'm just going to be myself. But those that are celebrating Halloween, happy Halloween to you. I want to redo a video I did yesterday. I kept being shadow bomb, and I see that y'all didn't like the unedited version. So we're going to try this again. For those that are new to my channel, my name is Tara. I am currently 7 weeks post-op from gastric bypass surgery. I want to introduce myself. I'm going to start off today. I've got my food in the toaster oven, in which I will eat for breakfast. It's just some leftover cheese bites and 2 nuggets. That's what I feel like this morning. I've just in the last 2 days have not been in the mood to eat traditional breakfast, but I know that protein is very important. I will be following that up with a protein shake that I will be taking with me to have as my mid-morning brunch. So to start off with, I did have a lot of acid reflux problems pre-surgery and had kind of gotten it down with my diet. But because I was restricted on what I could and could not eat in the beginning, I did have to go back to taking a acid reflux medication, which this is Zantac. So this morning before I eat, I will be taking at least 85% of my daily meds. So we're going to start off with the Zantac, and then we're going to also follow up with Prilosec. Prilosec, if for those that don't know, mine is prescribed, but they do have over-the-counter medications too. I normally take 2 of these a day. It has time release, so I don't have to take any more than the 2, just the once during the day. So we're going to start off with those. For those that don't know, these are a little bit different. These are designed for people who've had digestive issues, or in my case, gastric bypass surgery, and we can only, consume a small amount of drink, food at one time. So the pill's about this size. So I normally take the 3 of these together because I can. Okay. And so I have that dose down for today. The next thing I will be taking, I'm sorry for steaming over you. We will be following up with my medication that I was prescribed for my gallbladder. I do currently still have my gallbladder. So for 6 months, I will be taking Utersold. I believe that's how you pronounce that. But this medication was recommended by my doctor to take for the next 3 to 6 months. So that's what I'm currently taking. Now, this pill is a normal size pill, I consider it. It was kind of difficult in the beginning for me to swallow it, and it does not come in any other size. So I did ask the pharmacist, and it doesn't, but it's a lot bigger than some of the other pills I will show you today. And I find it easy just putting it diagonal like this in my mouth and then drinking and having it go down. Alright, so that's that one. The next one is the Celebrex. This is a non-steroid anti-inflammatory that I was prescribed. This is what I will be currently taking, also to help with inflammation in my stomach. And this is what the medication looks like right here. And I take it the same way. I just put it the long way down. I And that is pretty much it. The next pill, I added this back to my regimen because I was finding too much of my food making me bounded, and I didn't really want to take a laxative like that or be codependent on a laxative. So this is just a probiotic. You don't have to get this specific one, but I do indicate that I introduced myself back to a probiotic that I take daily. And I also drink a probiotic water called Karma, which is very good as well. They come in many different flavors. There's like an infused water that also helps. After you have gastric bypass surgery, it does throw your hormones out of whack. It does. I don't know if anybody's ever talked about this, so I'm going to mention it. Having gastric bypass surgery can make you very, very fertile. It does not matter how old you are, whatever. It throws your hormones all out of whack, and you have to be very, very careful, especially the first year after having the surgery. You can have some hiccups, and that's even with you being on birth control. So you have to be very, very careful. In my case, I'm not really worried about it. I did have tubal ligation after my daughter. I know that was only guaranteed for 10 years, and she is 19 years old, but I also have an IUD as well. So just letting you know, you have to be careful after gastric bypass surgery. And they're telling you if you want to have children, you need to wait at least a year afterwards, because you put yourself very much so at high risk, and there's a possibility that your child may not survive. I'm not saying your child won't, but it's a high risk possibility that it won't. But anyway, this is the probiotic. This is what it looks like. Alright, so I've taken that for today. Because the calcium that I am currently taking does not have the vitamin D3 in it, I went back to taking these. I did have these pre-surgery. There's nothing wrong with these. They're very small, very easy to digest. So I just have been adding that combination myself. So this is what that looks like. This is vitamin D3. Alright, and it's 2,000 IUs. So I've taken that. Now, the other two things that I need to take are both my prenatal, I'm not pregnant, my bad. And that's nothing wrong. You can take prenatal vitamins even when you're not pregnant. But I need to take my bariatric vitamin and my calcium. So for right now, being that I've taken the vitamin D3 and it mixes well with the calcium, I'm also going to go ahead and take my magnesium pill. Take 2 of these. These are chewable. Alright, so I'm going to go ahead and take 2 of these. Okay, I got them down. Now calcium.
Yeah, you peed your pillow.
Followed by the calcium chew. So I will set my timer for an hour so that I can come back and take my bariatric vitamin. I'm going to also go ahead and get it set up to put in my bag because we are getting ready to go somewhere in a little bit so that I can have it. These were available at Walgreens for $11.99. I just felt like these, I would get more use out of them versus the one that I had before. So the only other thing I have to take, bariatric vitamin and my Flonase, which I'm getting ready to take now. That's all I had for right now. Hope you all have a wonderful day. See you soon. I'll be back later on. Bye.